everybody doing today?
Hi.
Good.
It's good to see everybody.
Likewise.
I haven't
Yeah.
seen you in so long, and
I
you're
know.
really coming along. When do you
I
do?
am. I'm doing January, so yes.
Oh, that's great.
Congratulations.
Thank you,
So
thank
something.
you.
Oh, that's really exciting.
Yes, it's
Yeah.
exciting. Feeling well, but there's a lot of things to prepare and take care of, but it's a great time.
That's so interesting. You know, we've been working on a project actually about women living with the virus, with HIV, and about how they prepare for pregnancy.
Oh, wow.
Yeah.
It's an excellent and very, very important topic for everyone to just become very informed as to, you know, how to prepare for a very exciting but a very challenging time in life. Yeah.
Yeah. I guess there are a lot of special preparations that people have to make who live with the virus, right?
In comparison to a woman who's not
Mm-hmm.
living with HIV, you know.
What would be some of those things? That's a
Well, I think
Great.
the most important thing for her initially would probably have a good relationship with her doctor, and to be able to be open enough to discuss the possibilities of her getting pregnant and what she needs to do, you know,
Sure.
to protect herself as well as her partner. You know, one or both might be positive. So then, if we're looking at him maybe not being positive, then we need to do what we can to keep him from becoming positive.
That's true. But I heard that most pregnancies, positive or negative, aren't planned at all.
That's right. Most of them not planned. So that's why it's so important to have that type of relationship in advance with your doctor of the possibility that that might happen.
And they call it preconception health.
Preconception health.
Preconception, absolutely, you're right.
She would know she's a nurse, right?
Definitely.
Yeah, and I can imagine for women, after, you know, you said that, I was thinking for women who have pregnancies or are not planned, but they're, you know, at an age that if they have sex, they come, you know, they can become pregnant.
It's
Many
always-
women are having sex, and they need to understand what that could entail, what that means, and become informed.
I heard that it's actually a woman has to use dual contraception.
Yes, not only with the male using male condoms, but the woman on some type of birth control, whether it's a shot or an actual pill itself.
Yeah. Well,
IUD.
because sometimes condoms fail.
Yeah, sometimes they do fail.
And sometimes they just don't get used. You know how that is.
Most of the time they don't get used.
Yeah.
That's true. That's
So
true.
there's a lot of different choices, or the shot, or, you know, condoms. So I think, just like you said, going back to talking to your doctor to make sure what are all the different options and what's the best thing for each woman to do is key.
Especially if she's
Yeah.
HIV positive.
Actually, you know, somebody was telling me, you know, Dr. Al-Qaeda, she was
Yes.
saying that what they have to do first is to get as healthy as possible.
Oh, yes. That is, I think, one of the most important thing, to make sure that their T cells is above 350, that they're on medication for HIV. If they're not, you can start HIV meds ahead of time if you're planning on getting pregnant. That's one thing you can do.
When you say T cells,
I mean,
what do you...
T cells are the white blood cells that's actually in your immune system that help alert the body when something foreign is entering, like different, I don't want to say
like
viruses.
or
Any
different
viruses.
illnesses,
Yeah,
right?
yeah.
So we
yeah.
need to keep that number.
We want to keep it as high as possible because we know the higher the T cell, lower the viral load.
Yeah. As a nurse, like, what would you recommend for a woman who's living with HIV in terms of planning ahead or preparing? We talked about, Arnetta said about talking to the doctor and
Yes,
so on,
that's right.
and medication and all.
Right. I mean, I think across the board, regardless if you're positive or negative, is, you know, making sure you see your doctor. Of course, there's special needs for HIV positive women, and trying to be in the, you know, the best health that you can be. You know, with HIV, you know, being HIV positive, you have to think about, you know, as Arnetta was saying, your viral load, your CD4 counts, and seeing your doctor regularly is
So you're talking
important.
about
Preconception. You know,
What is it? You mean preconception? You mean like
before you even get pregnant?
before
you
you
know,
even like
making
conceive
sure,
anything?
exactly, and making sure that
Yeah.
you know the virus is undetectable in your body, and getting you optimal for having a child. And
Right.
that's
why
why
they say they want
delivery.
your T cell as high as possible. I think it's over 350. They really want it to be over 350.
And T cell is the same as CD4.
CD4
like
is the
people
same.
Use that?
Yeah, it's the same thing.
Mhm.
Just CD4 is your T cell, and as
Yeah.
I said earlier, it's the white blood
Right.
cell that's in the
Right.
immune
Mhm.
system.
Right. So when the T cells or CD4 is higher,
When your T cells or
They
CD4 is
go up.
high,
Mhm.
your viral load is lower.
Goes
and
down.
And the viral
Mhm.
load is just the amount of the virus is actually in your bloodstream.
mm-hmm.
So as you maintain that, the higher you have your CD4 T cells and the lower the viral load,
Yes.
the greater the chances that you'll have a healthy pregnancy and a healthy
pregnancy.
baby.
Absolutely.
Because I've heard that it's really a woman who's living with the virus can have a safe and healthy pregnancy as long as she takes the medication.
That's
right.
right. That's
Mhm.
right. Because the medication help reduce the chance of the baby becoming positive. It's like 1 or 2% chance
Mhm.
that the baby will be positive.
Mhm.
So that's a great percentage. We're talking like 98% chance the baby
Wow.
will be negative. Also, the fact that she's on medication, some of that medication will actually get in the baby's bloodstream as well,
Is that
and
so?
that'll keep the baby from getting requiring the virus too.
So if you
Really?
take the medication as you should, there's about a 98% chance that the baby will be negative.
Absolutely, that's
So-
great.
So, because sometimes I hear people say that these medications or just any medications can harm the baby.
Well, you know,
But
I
that's-
found out that once you get pregnant, or I think the most important thing before you get pregnant, I believe that the doctor will sometimes put you on a different type of HIV meds that will be more beneficial for you and the baby.
I heard that. Actually, I
Mhm.
heard some of the HIV medication is not necessarily good for the baby.
That's right.
So the doctor switches. I also heard that the doctor puts people onto special, is it called prenatal medicine? Prenatal
Prenatal.
vitamins?
Mhm.
Is that what that's called?
Yes.
Absolutely.
Mhm.
Folic acid
They want
and
them to.
different.
They
Mhm.
definitely want them to be on that
Mhm.
as well.
So actually taking medications is not only a great thing, it's necessary
It's
for
necessary
the baby to be healthy. So
Mm.
that confusion sometimes of should I take meds or not, it's very important to know that there are certain meds that you have to take or you should take, and
Mm.
especially prenatals,
Mhm.
prenatal vitamins, and the medications that your doctor specifically
The strap.
asks. So
Mm.
we keep going back to, like just you said, how important it is
Mhm.
to talk to your
the
doctor.
Yes.
Uh-huh.
Yeah.
Actually, I was reading a study. You know,
Mhm.
that's all I do, right? I was reading a study, and it was saying that women who have a better relationship with their doctor are more likely to have a healthy planned pregnancy. It's interesting,
Yeah, I
huh?
think it's mainly because she'll be seeing him on a more frequent basis.
Mhm.
And initially, once she become pregnant, she'll probably see him maybe 2 or 4 weeks to make
Mhm.
sure that the
That
HIV
everything
med
was
is
okay.
working well. Yes.
Yeah,
Mhm.
yeah. You know, I was wondering if a woman has to plan ahead, that would mean that she would have to plan ahead in terms of what kind of contraceptive she uses also, right? Like if she was on the pill, she would have to plan ahead about going off the pill and so on, right? Isn't
That's
that so?
right.
Absolutely.
Yeah.
That plus, not only that, there's a lot to consider as well, whether her partner is positive or negative.
Right, exactly.
You know.
Exactly. You know, somebody was saying that there's something called timed intercourse. Do you know what that is?
I think that is that's I love that time intercourse. You're timing in the most fertile time of the month,
Mhm.
and I do believe that the time intercourse is something where you have sex only during those times and using protection the other times.
I see.
You know,
Yeah.
prevent
Yeah.
from infecting your partner if he's not already infected, or reinfecting him. You know,
Yeah.
with maybe another strand of the virus.
Right.
Mhm.
And a
Mhm.
doctor can explain, right? You would know that, right, Natalie? That a woman can actually chart in her menstrual cycle when
Mhm.
she's more fertile. Isn't that so?
Absolutely.
So, you know, I know we're talking about getting pregnant and how a woman would get pregnant safely. But let me ask you about viral load. You know, we were saying that a woman wants to make sure her viral load is low. And I think, as I understand, and correct me, Natalie, but a woman a baby is most likely to be infected around the time that the woman delivers. Isn't that correct?
Right.
Right. So I'm thinking if a woman is undetectable, that means.
If she's undetectable, that means the virus is very low.
Mhm.
That is actually maybe cannot be seen are measured at that point in time,
Mhm.
which is the most healthiest we believe that woman is at that time to
Right.
deliver her baby.
Right.
So the baby will be born negative at that time.
Right. If she has undetectable viral load.
Undetected viral load, she's taking her meds as prescribed by her doctor
Mhm.
and is constantly getting care
Mhm.
and seeing her doctor, meeting all her doctor's appointments.
So I think you said a really important thing because the woman needs to know what her labs are, right? Where her
That's
CD4
right.
and viral load are at delivery, at the time that they're
Right.
ready to deliver. Because
Yeah.
if that's the highest chance you have of transmitting or giving the virus to the baby, you really need to know if you're undetectable or not. So you need to make sure you make it to all your doctor's
Mhm.
appointments so they can keep your labs.
Right. So they monitor it. So you working over at OBGYN, working with women who are pregnant, right? All the women that you work with are HIV positive, isn't
Yes.
that so?
Yes.
Yeah. And when those women give birth, can they have a regular, what do they call it, a vaginal delivery? Or do they have to have a C-section? I've heard both. Why, I mean, what's the
And
difference?
That's a great question because you could, HIV positive woman who's pregnant could have either a vaginal delivery or a C-section.
Mhm.
But what determines that is the woman's health. So we keep going back to the same thing we've been talking about, throughout this conversation, how important it is that the woman has great health. And what I mean by that is that their T cell, CD4,
Right.
is as high as possible, and their
Right.
viral load is undetectable, which
Undetectable.
means
Yeah.
as low as possible.
Right.
Because if not, then they would need a C-section. But that's a
Right.
decision that needs to be made between the woman and her doctor.
Yeah.
They need to
Way
make that
beforehand. huh?
Right.
decision together.
Yeah, I have heard about women who kind of want to make that decision themselves. I think that would be dangerous,
It
don't
would be
you?
dangerous.
Yeah.
Especially if they're not really sure what their health is at that
Right.
time.
Exactly.
Or a
Right.
woman who's in poor health.
Mm-hmm.
You know.
And haven't been taking her medication.
Yeah.
Haven't been taking her medication. Maybe her T cells are very low.
Or the
would-
viral load is, what is it?
really high.
Yeah.
Disproportional, yes.
Mhm, mhm.
Mhm.
Wow. Hey, listen, I know you have to go.
Oh, that's right.
Yeah.
Thank
Well,
you so much.
congratulations.
Thank you.
Okay, I'll
Yeah.
see you guys.
Okay,
so
Bye.
see you later.
Hey.
How are ya?
Good to see you.
You know, we were just talking about the work that Marissa is doing over on, what do you call that? The clinic? The clinic
The
where you
prenatal
Be
clinic,
prenatal
prenatal
clinic?
immunology
Yeah.
clinic. We call it the PRIM clinic.
The prim.
It's an
Yeah.
abbreviation
Okay.
for prenatal immunology, where all of the women who are pregnant come and receive their prenatal care.
Oh, okay.
You know, Marissa was just saying that if a woman was in poor health, because we were talking about pregnancy because she's pregnant, but she was saying if a woman was in poor health, that it could have they could cause complications during pregnancy. What does that mean?
So there's two different things that could happen with women who are pregnant if they're HIV positive. So all women in general are usually pregnant for 9 months or about 40 weeks. But one of the biggest problems that we see in pregnancy is when they deliver too early, preterm labor, or the baby lives in a bag of water in the belly, and that kind of helps protect the baby as the
Right.
baby grows. And if that bag of water starts to leak,
Yes.
that becomes a problem because then it's a direct opening for infection. So
Okay.
that's what we call preterm labor. Or the other common complication that all women experience in different degrees is what we call preeclampsia or toxemia, and that's
Yes.
when their blood pressure starts to go up.
Okay.
And sometimes their blood pressures can go up so high that the only way to treat them is to deliver the baby
Okay.
to have the high blood pressure go away. So those are what we call complications of pregnancy.
And are all of those complications because of something to do with HIV?
No.
Are they more common for
No,
women
they
who
are not. So
positive?
we've done lots and lots and lots of research about the effect of HIV on the pregnancy. And just because you're HIV positive, it doesn't increase your chance of
Okay.
having preterm labor, of having high blood pressure, of having premature rupture of membranes, of having diabetes that you get during pregnancy.
that happens
Those
too.
are all common complications that happen to usually pregnant women that are very young,
Oh.
or pregnant women that are older, or pregnant women that have weight issues back and forth. But HIV is not a factor that would increase your risk of complications. Just being a woman and being pregnant and having other risk factors would put you in the category of pregnancy complications. HIV is a chronic virus that lives in your body.
Right.
And so during most of your life that you're living with HIV, with very rare exception, you're taking medicine to keep your viral load down. Right?
That's what we were saying.
And keep your immune system working well to fight all infections.
Right.
So you would want to take your medicine every day, regardless of whether you're pregnant or not, but particularly in pregnancy, because we learned that when the viral load is suppressed, great things happen.
That's right.
So you have a healthy pregnancy and you're not susceptible to the AIDS-defining illnesses, right? You could get pneumonia when your CD4 count goes really low.
That's true.
You could get other infections when your CD4 count goes really low.
That was what we were saying about T cells.
Yeah.
Yeah.
T cells.
CD4
Right.
T
T cells or CD4 cells.
It's the same
right?
thing.
And when your viral load gets really high, that means that you're having a lot of virus in your body. And that puts you susceptible to an AIDS-defining illness, which we can avoid by just keeping the viral load suppressed. And you can live years with your viral load suppressed and your immune system working with your high T cells. But the other thing that could happen when your viral load is suppressed and your T cells are up is it reduces your risk of transmitting the infection to other people.
Right.
So
Especially
that,
to your baby, right?
especially to your baby. So we learned through many, many years, 20 years I've been doing this research, and research from all around the country, that if the viral load is suppressed, and if the CD4 count is in a good range, and if you take your medications, so at or around the time of delivery, which is really the time that you transmit more than 95% of the time,
That's the
because
highest risk.
anybody who's had a baby knows there's a lot of blood and secretions, and that's where the virus lives. So if you have undetectable viral load at or around the time of your delivery, your chance of transmitting the virus to the baby is almost zero.
That's true.
So those are three things then, right? At the time of delivery, if the viral load is suppressed and the immune system
Is up.
and
You take
You're
your
taking
medication.
and taking the medications,
As
right?
prescribed.
So,
Right.
so what
That's it
happens
at that time.
when
Yeah.
you're in prenatal care? A couple things happen. They do a viral load right around 36 weeks,
Okay.
right? Almost the beginning of 9 months, and that blood test is really important.
Right, that's what you were saying.
Sometimes women miss that blood test,
Yeah.
but that blood test tells us, okay, if she goes into labor and her viral load is suppressed, she could deliver vaginally and not transmit, because even if there's secretions in blood, which we know there would be,
That's right.
the amount of virus is undetectable, so the chance to transmit it to the baby is almost zero.
But if she missed that, what happens
Then we don't know what
She
her
doesn't
viral load
know,
is,
yeah.
and once you go into labor, you could deliver at any time, right?
Right,
Some
right.
women have short
So the
labors,
virus would be
and
present.
it's really
Yeah.
well. The problem if you miss the lab test is that it takes maybe a whole day to get the results back.
Oh my God.
So by
So you
time
don't
you get the
know.
results back, you may have already delivered.
Delivered, yeah.
So what they do is they err on the side of caution. And so if you don't have a viral load from 36 weeks, you're going to get an automatic C-section.
Okay.
Because there's no way to know
Yeah.
that your viral load
Right.
is suppressed. So that's an important lab test.
Yeah,
So if
that's really important to know, right? If
Sure.
you haven't had that test, you're going to have a C-section because they don't want to take
More
a chance.
than
Absolutely.
likely.
Sure.
Sometimes women come in and they're too far along to have the test.
Mm-hmm.
So then the baby may need extra medications right at the time of the delivery to try and help.
What you
So-
mean, extra medication?
So all the babies get AZT.
you mean from birth?
From
After
birth. From birth.
Okay.
So AZT is a straight up drug that we know is good for prevention. So let's say a little tiny droplet of HIV
Is that
came
liquid
across.
form?
Yes, it is.
Okay.
So we give the baby AZT as like a precaution
Okay.
to reduce the viral load just in case case there was any transmission. But the pediatric infectious disease doctors have lots of meds that they use for infected babies. And if there's a delivery situation where they're concerned that maybe this baby is at more risk because we don't know the mother's HIV status, or we don't know, they may talk to the mommy about giving the mommy more than AZT for that baby to further reduce the viral load in that baby and further prevent transmission.
Now, wait a minute. I'm overwhelmed. This is a lot of information, and it sounds like there is a lot of planning
Ahead of
that
time.
has to go
Right.
on. And this is just at the time of delivery, right?
That's right.
And, you know, we were talking about how women have to plan before they even get to this point. Well, I can really see why they have to plan ahead with all of this.
There's a lot of ducks to get in order.
And I can see
Absolutely.
how important it is to just always make it to your medical appointments
That's
and be open and comfortable to talking to your doctor, because you need to be informed of all these things that happen from even before, what we called, what was it again? Preconception?
Yes.
Preconception to all the way to delivery. And as long as you have that constant contact with your doctor, you'll always be informed. So you'll be more ready and more at ease
To have a healthy.
pregnancy.
Well, you know what I was thinking about while Janelle, Dr. Potter, was talking, was that you're an expert. We were talking earlier about timed intercourse,
Time.
right? And you just said when a woman takes her medication, it reduces her chances of infecting a baby. But the same must be true, right? That when a woman takes her medication, it also reduces the chances of infecting her partner.
That's absolutely correct.
Yeah.
And a lot of women think once they're pregnant, they don't have to worry about birth control anymore.
Because they're pregnant already.
And so some women associate,
They think, oh, it's a holiday now.
and so they think they don't need the condoms. But remember, we're using condoms for another reason
Right.
as well.
Absolutely.
We're using condoms to prevent the transmission, so to the partners.
Right.
And so it's still important to use the condoms, but as we all know, condoms break, and we also know that sex can be fun, and that sometimes there's secretions back and forth that are not captured in the condom, and the virus lives
Sure.
in the secretion.
Yeah.
Absolutely.
So if you're taking your medicine and you're reducing your viral load, that's step one. Step two is every time that you have sex that's going to have penetration, you should encourage your partner to use
Use a condom.
condom.
Right?
But we're talking about a woman who's already pregnant. Let's say on the next pregnancy, or between pregnancies, a woman wants to plan to have her baby. That's what I think you meant about
Yeah.
timed pregnancy
Exactly.
and timed intercourse. So we know that women have their menstrual every month,
Right.
but you're not able to conceive a baby every single day of the month.
That's right.
So there's certain parts of the month that you're not fertile. And then there's a time where the egg is released, and that's when you want the sperm to get to the egg to fertilize the egg so you can become pregnant. And that's usually in the middle of the cycle. But unfortunately, as much as we know about science, we do know that everyone's cycle is a little different.
It's different, and that egg can be released at any time during that time.
That's right. That's right. And there's certain things that we can do to kind of figure out when we're fertile, but you have to have the timing just so, because the sperm doesn't live very long. It goes on a long swim to find that egg, and if it doesn't find that egg, it just peters out and dies.
Yeah.
And the egg only lives for a day or so, and then it sloughs off and you get your menstrual.
That's
and that's
right.
how that cycle works.
That's
right.
So timing is
It's
very
timing
good.
is
Yeah.
So timed intercourse,
Right.
where you would actually take off the condom so that the sperm could get to the egg and
Right.
fertilize it would be a good thing to do, as long as the viral load is suppressed and
Yeah.
you're not risking HIV to your partner.
Right.
So that's something else you can talk to your providers about, who can explain how
Yeah.
it goes.
Yeah.
And there's ovulation kits, just like pregnancy kits, that you can buy at the drugstore.
Yeah.
And you dip your secretions Like you just
Yeah.
stick your finger around your vagina and you put it on and it'll tell you if you're fertile or not.
I didn't know that.
That part I really didn't know.
And the natural
Oh,
people,
wow.
the hippies from my generation, they did what was called natural contraception, where you take your temperature every day.
See,
Oh.
When
that's
you're
right.
ovulating, your temperature goes up.
Oh, really?
Yeah.
I
And
didn't
your
know that.
mucus, most women
You mean in the
have-
vagina? The mucus.
Right, you can
Uh-huh.
stick your finger, and most women are wet. But when you're ovulating, when your temperature goes up, you can take some of that wet and you do this. And if it spins, if it stays together, instead of being really clear and breaking apart, if it's thick and it stays together, you're fertile. And
my.
nature does that because it wants to grab that sperm.
That's the
interesting.
reason why.
Ah.
Yeah. So
Interesting.
that's the natural method that all providers know about, that women can start timing from the first day of their menses till the next first day of their menses and try and figure out when their temperature goes up, when they have fertile mucus, and keep a log.
And menses is when they're having their
the
period,
period,
right?
right.
Right.
All right.
So I guess there are different ways that women can get pregnant without risking infecting their partner, right? The one that, I mean, for years, the one that I heard about a lot was sperm washing, but really, I have no idea what
Neither
that's
do
about.
I.
You know, it sounds like something
Yeah.
you do in a lab.
What is
Yeah.
sperm washing?
Yeah,
Does
what-
anybody
Do you know
Oh,
anything about
sure. So, you go to an infertility doctor, and you meet with them, and they help you conceive a baby, not the regular way,
Okay.
You mean like
In a
artificial?
artificial.
Right.
So one way is to do sperm washing, where the man goes into a private room, usually with funny books, and they ejaculate
Yeah.
into a cup.
Right.
And then they take that sperm and
Right.
they wash away all the secretions,
Uh-huh.
but they keep the little sperm
They
alive.
keep the sperm.
And then they put it in the woman's vagina
Wow.
without the secretions. And the idea
Yeah.
is that they wash away all of the HIV,
Right.
and it makes for safe conception.
Isn't that really expensive?
Very
though?
expensive.
Don't you need insurance?
And
and
insurance doesn't
everything?
pay for that.
No.
Oh, wow.
Not yet.
Yeah.
We need to advocate for that
Yeah.
for women that are living with HIV. But for right now, it's a limited option.
Right.
But there's another option that's really something that is available that would help all people, especially discordant couples.
You mean couples where one person is
Is
positive and
the
one
other person is negative, and they
Uh-huh.
want to make a baby, but the
Right.
negative person doesn't want to get exposed to the HIV secretions.
Yeah.
And that's using something called PrEP,
Prep.
where we're used to giving antiretroviral or ARVs,
Uh-huh.
which are the antiviral medications to
Right.
HIV positive people.
Right.
But with PrEP, they give the antivirals to HIV negative people. And they take the pills, and when they're exposed to the HIV, they've got an antiviral activity going on in their blood, and they don't get infected.
So you mean that, like, imagine if a woman is positive and her partner is negative, the woman, maybe she's on medication, her viral load is suppressed, but the man, the partner, doesn't want to take any chances. And so he asks for PrEP. What is PrEP? Is
It
it like
stands for, it's an acronym or four initials,
yeah.
and it stands for pre-exposure prophylaxis. So prophylaxis is prevention.
How could a man get something like that?
They would
PrEP.
have to go to the doctor. So
Right.
the woman ideally is in, if it's the couple where the woman's positive,
Sure.
they would go to the woman's provider.
Mhm.
And many providers understand that discordant couples want to have access to pre-exposure prophylaxis, PrEP, and so the doctor would write a prescription, or the man could go to his primary care provider, and then they would get a prescription. Say I'm with a woman who's positive and I want PrEP,
Yeah.
and then it would be prescribed and paid for by the insurance.
But this
You
is,
know-
I want to ask this question though, but this is just for planning for pregnancy. It's not something that just because she's positive and he's negative, he automatically could get this medication.
So this is new.
I think he could.
I think so
I think he
too.
could, yeah.
I don't want to say blanket yes,
Right.
because some providers, that's your provider, may not be familiar yet with prescribing, but this is a conversation. This is why
Yeah.
we really
Yeah.
want to help people go to their providers and talk about it and say, I need this, I'm in love, I'm having a relationship with a person who is positive,
Right.
and even though her viral load is suppressed, and even though I'm going to wear a condom, I still want to take that third step and have PrEP so that I reduce my risk of acquiring HIV to 0.
Well, you know, actually, I was at a clinic yesterday, and they said that they are offering PrEP, whether or not people are in love, but they're offering it to people who have sex partners who are positive. So you can go to a clinic and
get the
ask
medication.
for that. Yeah.
Oh, wow.
And I also heard for people who are not on the Affordable Care Act that the company that makes the medication for PrEP is offering discounts, like a sliding scale, very low cost, for people who would be eligible, who are at high risk of infection.
That's wonderful.
Wow.
It is wonderful.
Sounds like there's so many different options. It can be a little confusing, right, or a little overwhelming. So I think what we need to remember is that an HIV positive woman who is thinking about or wants to become pregnant at some point has many good options to stay safe and to make sure that their partner is safe. So the key is, you know, to make sure you're informed, talk to your doctor,
Talk to your doctor.
Yeah.
know what's out there,
Yeah.
because there are great things that can keep you healthy.
Yeah.
Absolutely.
You know, one of the things that what you were making me think about was that some women who are HIV positive haven't started on medication yet, but then they're ready to start because maybe they want to get pregnant now. That's really a big commitment, isn't it?
It is a big, big commitment because you have to take this med for the rest of your life.
Yeah.
Once you start, it's no week where you take a day off or a weekend off, a holiday. It's a commitment once a day, every day, or how many times a day that you need to take this med. I can specifically talk about myself. The hardest decision for me was making that commitment to taking that meds and making the decision when to take that med. So if you're thinking about becoming pregnant, that is something that you really need to talk to your doctor and make a commitment. I'm going to take this meds to reduce my viral load, so I'll give my baby every possible chance of being negative.
There you go.
Yeah, yeah. Because if somebody who's positive is on medication and they don't take it the way it's prescribed, maybe I had a late night, you know, and I forgot or whatever, you know, I was running around, who knows. And I forgot to take my medication. I think at some point the virus starts to come back up again, right?
What happened?
Yeah.
It'll build a resistance to that med,
Really?
and it'll no longer work for them.
Like antibiotics, the same thing.
So then, therefore, they'll probably have to end up taking another med because that med no longer works for them. And especially if you're thinking about becoming pregnant, you know you can't do those things. You've got to make a commitment to take that med. You got to make a commitment to make your appointments and take the lab works very serious.
Yeah, yeah.
So I think that I agree with you. Taking meds are really a big commitment.
Big one.
And the other thing that I do know from working in this field for many, many years in women's health is that not all pregnancies are planned.
Absolutely.
You know, sometimes you know, you have a late night or you have a moment of passion and you don't have contraception and you get pregnant. And all of a sudden you find yourself pregnant. So I think that the most important point is to think about seeing a provider as early as possible, whether it's before or as soon as. And we've used a lot of medical terms, but really what we're talking about is preconception planning. And what that means is before you conceive. And that's ideal, but not always possible. So sometimes you find out that you're pregnant and you're not as organized as you had hoped to be, and the doctor or the nurse practitioner or the provider says, okay, we'll make you an appointment. How pregnant are you? Well, I missed my first period. And remember, we threw around terms like gestational age, which is by month, or
Okay.
by week.
Okay.
So gestational age.
You mean
there's
how old the baby
how
is?
big the baby is growing. So it starts from 0
Right.
and goes to 40. That's
Right.
the gestational age. Gestation sounds for the baby growing inside of you, and it's measured by weeks.
Okay.
Or months, 9 months. And then we talk about getting in as early as possible, as early in your gestation as you can, so that you can get on medication.
And prevent perinatal transmission,
Prevent
right?
perinatal transmission. Another big word that means not transmitting the virus to the baby. Once you're pregnant,
Right.
you
Choice.
have to take medication
Oh, yes,
Right.
okay.
during pregnancy to prevent the virus from going to the baby.
Mm-hmm.
So that is the reason why you have to get to the doctor early,
And
so you
plan.
can find out what medications you need to be on, get started on those medications, and get onto a program so that you have a good outcome both for yourself
Yes.
and for your baby.
Good regimen.
Yeah, yeah, because there are a lot of things that don't mix with pregnancy, right? I'm
Absolutely.
sure that while you're
Oh,
pregnant,
wow.
there's a lot
Yeah.
of things that you've done differently, right?
There's so many things that change, even if whether you're pregnant or you're thinking about getting pregnant, there's just things you should, start making changes and thinking about in your life, like eating healthy,
Right.
Mhm.
making sure that you're going not only to your regular HIV doctor, but even your dentist, different type of
Yes.
doctors that make sure that your overall health is okay. You definitely need to stay away from alcohol, drugs, cigarettes, different things that just
Yeah.
affect your health. So if you know that it's something that you're doing right now in your life, to make sure that you feel comfortable to talk to your doctor to get so he or she can help you start making those changes.
That's right.
Right.
And we know if you're drinking and drugging, you're not going to take your meds.
Mm-hmm.
Yeah.
You're going to miss your meds.
Yeah, yeah.
So that's going to cause a bigger problem.
Right, right.
Mhm.
And I've also read a lot about women who suffer from depression.
Oh,
Right?
yeah.
Mental health is a big thing for women to pay attention to as well. You would know that. That's your area,
Yes.
right?
And even again going back to whether you're pregnant or you're thinking about being pregnant or getting pregnant at some point, if you're a young woman living with HIV, that you're at an age that you're having sex and you can have a baby, these are things that can have a huge influence or impact on your mental health too.
That's
and your
true.
mental health can have a huge impact on that. So it's very important if you feel that you're just not feeling well, there's difficult things that you're going through in life,
Right.
that you feel that you have someone to talk to.
Mm-hmm.
We all need, right, that person to talk to in life. So
That's
it's very
true.
important that you have all those areas in your life taken care of.
So your mental health as well as your physical.
Absolutely. They go hand in hand together. Your mental health impacts your physical health, and your physical health impacts your mental health.
The thing that I really spent more time thinking about than how to get pregnant was how not to get pregnant, right?
Exactly.
That was my number one.
And we approach women's health when they come in to see the gynecologist. It's usually, okay, what kind of contraception are you using? And contraception's a big word for how would you like to prevent pregnancy. So the first thing that you have to decide, do I really want to prevent pregnancy, or do I want to talk to my doctor about preconception planning?
Okay.
So if preconception planning, I think we've already talked about, but the prevention of pregnancy, there's lots of options. And if you like to take pills, then birth control pills, which are very, very low dose hormones right now. And if you're a good pill taker, you could just throw them into the mix of other pills that you take with your antivirals and take a pill every single day, and that is the most effective. But some people don't like to take
That's
pills.
true.
Yeah.
That's
And
true.
so you have short-term options and you have long-term options.
Are pills short-term options? I mean,
you can stop
start and
taking
stop.
pills at any point during the month and usually ovulate very soon after that. So I would
So that's
say
short-term.
short-term. The
And
other
condoms are short-term,
Sure,
right?
Absolutely.
condoms are
Yeah.
short-term. But there are things like injections that
Right.
women get where they
Injections.
want to just have to do something like once every month or once every
How long
3
do
months.
those injections
3 months
last?
So Depo-Provera
so.
is one injection that they have that you can get, where it's one shot, and for 3 months you don't have to think about contraception, but you do have to come back every 3 months.
Right.
Sure.
And then the long term is the IUD, which is a little device that they stick up in the uterus. So when that sperm comes to to mate with the egg, the sperm dies. It creates an environment, a pH environment where the sperm can't live.
You mean like, so the woman can get that IUD put in,
The doctor has to put it in, or
and
the nurse
she can't
practitioner.
get pregnant.
She can't get pregnant till they take it out.
And
if
how
you-
long can they leave it there?
They can leave it there for up to 5 years.
Some is 5 years, some is less than that.
Is
Some
it?
3.
Yeah, 3 years.
So they
But
will
I-
tell you based on the device they have on the shelf.
But I know for some women, the IUD has caused some problems.
So that was years ago, the copper 7, where the chemicals that they had in the IUD caused women to have some scarring.
Yeah.
But
Why?
they took all of them off the market,
Right.
and now IUDs are safe.
They're safe.
And they're made with different types of materials
Yeah.
and hormones that keep it perfectly safe for the inside of a woman's uterus. So you could go to your gynecologist one day and say, I want to take it out because I want to have a baby. And then next month you could ovulate and have a baby.
Is that so?
Wow.
Wow, so
So-
that's a good long-term
Yeah.
method.
So pregnancy
And
planning,
I guess you could get your tubes tied. I mean,
you could get your tube tied.
that's not a bad idea either.
that's if you're done.
For women who are done, right?
Yeah, but
So-
they're not going to do that at an early age, though, would they?
So they can do it starting at 21. But if you've already had 4 babies before the age of 21, you can sign the papers. You know, it depends on you and your relationship with your
Yeah.
doctor.
It's a personal decision.
What
a
if you're
personal-
HIV positive? Would they do it if you
If
HIV
that's
positive?
what you want and you've already had your children or you're beyond the age of 21. So what happens is some women decide they don't want to have any more children. And so they have their tubes tied, and then 5 years down the road, they meet the man of their dreams and they want to have a baby with that man. So the reason why providers are not really anxious to tie the tubes of young women is because you never know.
That's
Change
true.
your mind.
That's
You
true.
just never know. So that's a permanent big decision, and there's other options that are as safe and effective, like taking a pill every day or an IUD. So until you're certain or beyond your childbearing years, you know, those are good options for long-term planning. And then short-term planning in between pregnancies to space your pregnancies, which is something you and I just talked about, where you have a 3-year-old and now you want to have a new baby. So that's called pregnancy planning or spacing.
Spacing is important.
So I think
right?
we've covered everything from
You know,
soup to nuts.
The thing,
Yeah.
the thing that really jumps out at me is that every single one of these decisions, the doctor has to be involved,
Every time.
right?
From the very beginning.
Mm-hmm.
From the very beginning. Making your appointments, making sure you go to all your appointments,
Right.
making sure you get your lab work,
Mhm.
make sure you're there, and if you have any questions to
Right.
ask,
Right.
so you'll understand. Because a lot of people get their lab work, but they don't understand it. So they
Mhm.
need to be able to be comfortable enough with their physician so they can discuss whatever issues they have.
Very
So there
good.
might be some helpful questions for people to know to ask providers, right? So that I might sometimes write down what my questions are before
Yeah.
I go in.
That's true.
So I'm ready. You know, I find too when I go there, I can't remember what the doctor said
Yeah.
afterwards.
So to maybe write, information down, come ready with questions that you've, thought
Beforehand.
about.
Mhm.
Exactly, because like we've been talking about all this time, there's so many different options, and you just need to think about what is the best option for you at
That's
your
right.
point in your life. If you're ready to have a baby, if you're not sure, if it's something you haven't even thought about before, and to know what's the best thing for me. Is it a short-term pill? Is it a long-term injection? What is it that I want? And absolutely, like you just mentioned, just talking to your provider to make sure that you find that doctor that you feel very comfortable with, because this is very, very sensitive, right? And
Very
personal
sensitive.
topics, and it's something that we may not want to talk about with everyone. So you just
Yeah.
have to find that
Yeah.
one doctor that you feel very comfortable with. And there's many great, very, eager doctors to help you. So it's important to
Yeah. Have that relationship.
have that
right?
relationship.
Well, I wish you all the best with
Oh,
this
yes.
new pregnancy,
Thank you,
this
thank
baby.
you.
I can't wait to
I
see
can't
it.
wait. And I thank you because you shared a lot of information
Yeah,
that I
thank
learned
you
a
so
lot
much.
today. Thank you so
I'm
much.
so glad. I hope it helps a lot of people.